There's so much confusion around Medicare and Social Security. So in this video, I'm going to clear up how the two relate. Are you required to be on both at the exact same time, or are you not? You've worked hard for Medicare. Let's now get the most out of it. Again, I'm Emily with the Medicare Coach. 7 years ago, I helped my dad make his Medicare decision. I was shocked at the confusion in the market. And so since then, I've become the leading Medicare advocate to help you and so many others easily make the right Medicare decision, but also get the most out of your Medicare benefits. So to learn more of these inside tips, make sure that you like this video, subscribe to my channel. I look forward to helping you with your Medicare decision. So let's jump into this. Again, there's a lot of confusion around Medicare and Social Security, but the reality is most people will join Medicare at a different time than Social Security, okay? And the reason is that Medicare is a decision around your health insurance benefits, and Social Security is a decision around your actual cash flow needs, your retirement plan, as well as your unique circumstances, okay? So for that reason, most people join Medicare and Social Security at very different times, and that is completely okay. Please be thoughtful as to when you join each of these, because again, they have different reasons to do so. Now, with that said, if you were drawing Social Security 4 months before your 65th birthday, you will be automatically enrolled in both Medicare Part A and B, which will start on the first day of your 65th birthday month, okay? So if you're drawing Social Security, yes, you're on Medicare, but you can unenroll from certain parts of Medicare, okay? So with that said, if you were on Social Security before your 65th birthday, and you were also on an employer health insurance plan, you likely have a red flag. And the reason is I don't want you paying for both Medicare Part B and an employer plan unless there's a really good reason. It's usually a waste of money to pay for both, okay? There are exceptions, but it's usually a waste of money to pay for both Medicare Part B as well as an employer plan, all right? Now, if you were drawing Social Security and you were on Medicare Part B, or as well as A for that matter, your Medicare premiums will be taken directly out of your Social Security check on a monthly basis, okay? But if you are not on Social Security, no problem. They will be billing you quarterly. You can change it to monthly, but they'll default billing you quarterly for your Medicare Part B premiums, okay? Now, also, if you were on Social Security and you're on Medicare, there's a rule called hold harmless that basically says that your Medicare Part B premium cannot increase more than your cost of living adjustment on Social Security. And for this reason, many people who are on Social Security are paying less than everyone else for your Medicare Part B premium. Okay, so again, to kind of wrap this one up, Medicare and Social Security, they are related, but they are very different decisions and have very different rules depending on which path is right for you. Please be thoughtful as to when you join Medicare, as well as when you join Social Security. All right, if you found this helpful, give me a thumbs up. If you didn't find it helpful, give me a thumbs down, and let me know if you have any questions or comments in the section below.